Good afternoon, everyone. My name is Ana de Jesus, and I'm here to represent parents and also, as a professional, represent family supports in the children's clinic. So I'm fortunate to work at the children's clinic. Um, a little bit of back history. I am a single mom of a 19 and a 24-year-old. I was originally introduced to the children's clinic when I was 12 years old. A child of missionary parents from very humble beginnings. We were new to California, and I had developed a very nasty eye infection. We didn't have insurance, and I think it was the school nurse who referred my dad to the children's clinic. So that was my first introduction to the children's clinic. Later on in life, I was a young mom. I had a 2-year-old, and I found myself with no insurance again, and he was sick. And I didn't even comprehend at the time that this was a community clinic, but I remember that that clinic saw patients without insurance, and I know that my son was going to be taken care of. So that was my introduction to the children's clinic. Later in life, I came to work for the children's clinic as a community worker, as a medical assistant. A lot of the services that we have in place now were not integrated into our clinic. We didn't have social services, we didn't have mental health services in the clinic. I wore a lot of hats. We did a little bit of what we call case management back in the day. We worked with a lot of outside agencies, referring and doing things like that. And so I'm going to share a little bit about my history with trauma. So I was sent to a DV training by Dr. Nicholas as part of the training to help families kind of navigate our system. And so I sat in the training, and back then it was victim based. Now it's agency based. Now we go to training and they teach us where to send patients to, or how are they going to help. Back in the day it was more like victim based survivor stories. So there's this lady telling the story, and I find myself in the chapel crying and saying, and identifying myself and saying, wow, that's my story. I'm experiencing domestic violence. I had that aha moment, that epiphany. I probably knew I was not in a healthy relationship, but I had that aha moment. It took me to be somewhere to kind of realize what was happening in my life. Needless to say, it didn't happen right away. I left the relationship, I got healthy, but in coming today to speak to you, Dr. Nicholas and I were talking, and I shared this story with her. I then went home and I was talking to my daughter about it, and she told me, Mom, she saved your life. Have you ever had that opportunity to tell her? And I said, you know what, I haven't. So I had that opportunity to thank Dr. Nicholas and say, essentially not directly, but essentially, you saved my life. I don't know what would have happened. I don't know if things would have been different, but things changed. And it's because of the community clinic that we serve. As a professional, I left the clinic. I went on to become an LVN. I came back to work as an ER diversion case manager, which was working with the adult population. And in the last 2 years, with more training, I work as a family specialist through a project that's called Dulce. And basically, I feel like I always remember going back a few years, that vision of the TCC clinic and the mission of working and helping people, regardless of your background and regardless of your insurance and regardless, with that care and compassion and making it that personal connection. I'm not going to say the mission statement word by word because I don't recall it right now, but it's just taking care of everybody with care and compassion and making sure that the well-being of the child and the family. We're now serving adults as well as prenatal patients. We evolved from one clinic to now 11 clinics. And I always think of Project Dulce as going back to basics, making it personal, having that patient connection to the family specialist. I'm the liaison. I was a liaison back then of outside services, but now we're so integrated. We have medical legal partners in our clinic. We have behavioral specialists in our clinic. We have our behavioral, our education department, who provides a lot of services like CalFresh applications, transportation, education classes. We have infant massage, which works two ways. It's part of an education, part of a bonding and enhancement to the family, but it also helps as a support system for those parents that have or are experiencing isolation, social isolation. So we focus on those 5 factors, like connection community resources, social isolation. We screen for domestic violence, and we screen for postpartum depression. But having had history with trauma, and as a professional working with families that have history with trauma, it comes to the bottom line, is who you trust. So it's building that relationship. It's very easy to have questionnaires and screeners, but how are you asking these questions, and how are you relating them to the families that you're serving? How are you empathetic to what they're telling you, and how are they not feeling judged when they're telling you certain things? I'm feeling very humbled by this panel, by the way. I'm such a patient advocate, so it's very touching. But we have circumstances where families come into our clinic and they feel judged, and they feel like crucified. And sometimes we get busy throughout the day, and you have that medical assistant who maybe wasn't that nice to that family, and you come back to the family, you talk to the family, and they tell you, well, they're judging me. When we don't even know their history or their information, and they feel judged. And just being able to talk to them through it, and then even having that conversation with the medical assistant, maybe she wasn't even aware. She was having a busy day, and just giving them that back history. And then the next time they come, then they find that compassion, not only from the family specialist, but from the rest of the team. So it's just, I guess bottom line is, there are systems in place, there are screeners in place, but it comes to bottom line, who do you trust? How do you ask those questions? Making those true referrals and making those true connections. There's a lot of wonderful programs out there, but like Abraham mentioned, how do I access them? Who do I ask? So I think it's very important. Project Dulce is kind of similar to the home visitation program, only we're clinic-based. So they come to me, I don't go out to them, but it's having that person in the office, knowing that, and I'm only with them for the first 6 months of life. So eventually I kind of phase out of the picture, but the goal is to work as a team and get the whole team involved, and modeling that compassion and that empathy, and giving those true connections and those true referrals, and making sure that those connections are followed through their care. And I think building that strong foundation at the beginning is very important. I'm sorry I'm all over the place, but I think essentially it comes down to trust and to empathy and compassion, and making those true connections.